Skin beauty starts with a clean, fresh skin. We must remove any makeup and surface oil using a balanced cleanser. Clean the skin using a sponge or gauze type of 4x4 pad. Refrain from using cotton pads that will leave fibers behind, which may be vacuumed into the system. Dry the skin with a towel or soft cloth. If treating a thick or congested skin type, you may use a toner. Apply the toner to the skin, leave on the surface for 2 to 3 minutes, and remove with warm water. Toners must be removed before treatment because it will leave the skin tacky, making it difficult to glide the handpiece. The skin must be bone dry. Place a new tip on the handpiece. You will know if 40 is an appropriate level by seeing if the skin pinks up after the first few passes. If the skin becomes very red, turn the suction dial down 3 points. Always hold the top of the handpiece closed to get an accurate reading of the suction level. Hold the forehead in the middle with one finger and move horizontally toward the temple. By holding the skin with one finger, you will anchor the skin, reducing any surface lift. Place the handpiece directly onto the area without pressure of your hand pressing into the client's skin. The movement of the handpiece should be very relaxed and fluid without much jerking. Deliver a firm ending by twisting your wrist in the direction of your movement. By utilizing a twisting action, you break the suction and minimize further stretching of the skin. With each movement, move up towards the forehead and down towards the temple. Make all movements from center of the body out in order to push fluids into the lymphatic drainage areas. At this point, you will determine if the setting of 40 is appropriate for the client. The forehead area should look slightly blushed and not red or striped. In areas that require further abrasion, you may anchor the skin with 2 fingers and move back and forth across the surface in an eraser-type action for more concentrated abrasions. For the outer cheek section, hold the skin at the bottom of the chin and move upwards towards the temple. If you are dealing with a looser surface, you may have to hold the skin with 2 fingers and work in between the held area. Complete one side, then the next, beginning at the bottom chin and moving upward to the temple. If any sections need further aggressive treatment, anchor that area with 2 fingers and use the eraser-type movements. Avoid moving into the inner cheek location. This area, which includes underneath the eye and neck, will be done in the end at a lower suction level due to its thinness and sensitivity. If your client requires any additional work in problem areas, spot treat them accordingly. Moving to the chin, hold the middle of the chin and move from one side to the next. You may move from the lip area down to the bottom chin or vice versa. Spot treat if needed. Remember, you want to be sure you are seeing a pinking or erythema of the skin and the skin is not becoming very red or red stripe marks are appearing. Make sure you address the nasal labia or laugh line sections that tend to crease as we age. By working this area often, you will stimulate collagen and lessen furrow lines. If any area of the skin does require further treatment, anchor that area and move back and forth. To perform microdermabrasion treatment on the upper lips, hold the middle of the lip and move outwards. Continue holding the upper lip and move to the other side, always outwards to the cheek. What you're trying to do is to create a pattern, first working horizontally to abrade all areas of the face. Work any smoker's lines on the upper lip more aggressively, utilizing the back and forth action. To abrade the nose, you will begin at the T-zone and move down the nose to the tip, then move from one side to the next. Take notice of broken capillaries that may be present underneath the nose and avoid these sections completely. It is beneficial to stay on the nose with complete suction because of the various angles and curvature. Maintain contact with the skin clearing out enlarged pores and blackheads. The diamond system does a wonderful job of loosening blackheads. Many of them are removed during the treatment and more released over the next couple of days. Finish off first pass by going around the eyebrows. Leave out underneath the eyes, inner cheek, and neck. These areas will be handled after second pass. Second pass will be done vertically. We hold the forehead at the top of the eyebrows and move back towards the hairline. Each stroke, remember, is a count of 4. 1, 2, 3, 4. What you're doing is you're giving yourself enough time to complete the sections as well as to engage the suction and provide for maximum exfoliation of dead cells on the surface. The deep furrows on the forehead may be treated aggressively to refine and lessen the demarcations. Sun-damaged areas can also be addressed with this type of movement. To complete second pass of the outer cheek, you will move vertically across the area. If you remember from first pass, we went from bottom of the chin to temple, and at this point, we will cross the cheek, making a modified J or C shape, moving vertically as best we can. A crisscross pattern is recommended to be certain all surface areas have been exfoliated. Moving to the other side, cut across in a J or C-like fashion, going up to temple at all times. The purpose in addressing the temple area is to open lymphatic drainage nodes in that location, thus providing those nodes with stimulation and drainage for the body. For the chin, you may either move from the chin to the lip or from the lip down to the chin. Make your choice based on your technique. Hold the skin taut using slow, steady movements. Microdermabrasion refines the skin surface scars by providing a blending effect to the surrounding tissue. Over a period of time, it will aid in tissue repair and balancing cell regeneration. If your client has any issues that require extra exfoliating or stimulation, such as acne scarring, laugh line demarcation, crow's feet wrinkles, or excessive oil in the T-zone, you may do repetitive strokes to meet your client's goals. Exfoliate the upper lip vertically as best you can. Due to the limited space, strokes will be short. Microdermabrasion is great for refining lip lines, adding plumpness. People tell us that a series of treatments can bring the same results as collagen injections. Give those clients with smoker's lines multiple passes to lessen the wrinkles. Microdermabrasion is quite successful in providing excellent collagen stimulation for this area. For second pass with the nose, move from the T-zone down to the tip and stay on the nose. You may move across the area again in the same direction or make circles or swirls to provide for maximum exfoliation in clearing large pores and blackheads. Remember to get underneath the nostril area where oil tends to pool. Avoid any broken capillaries. Extractions can be performed a few days before a microdermabrasion or after treatment. The top layer holding the bacteria will be thinned and extractions will be easier. The cleansing and balancing effect of the suction, combined with microdermabrasion surface refinement, is an incredible new way to control and minimize skin breakouts. Trapped debris is reduced, thereby limiting pore infection. Once second pass is complete, hold the tip of the handpiece and turn down the suction at least 10 bars from where you were working, meaning that if you were working at 40, turn the suction down to 30. With the eye area, because of its delicate nature and very thin skin, you will break up your pass into 2 parts. Move from underneath the eye to temple, lifting up in the middle, basically a count of 2. 1, 2. If you have a longer section in the inner cheek, you may use a count of 3. 1, 2, 3. Always move to temple. Proceed downwards towards the cheek to complete. It is best to hold this section with 2 fingers to firmly anchor the skin. Do not overstretch or pull this sensitive area. For second pass in the eye area, you will be moving downward from the eye into the inner cheek like a sun ray. Move gently and slowly to engage the suction and stimulate blood flow. Move to the other side and complete pass 2. If there are any contraindications with the client's skin, such as broken capillaries, moles, rosacea, you need to avoid those areas or work with caution if you are a more experienced technician. At this time, the neck may be exfoliated with the suction low. Begin at the bottom of the chin and make 1 pass to the middle of the neck. Then proceed from the middle of the neck to clavicle. Do not complete the neck in one long stroke. This will cause excessive reddening and streaking. The second pass will be from midline out to the outer neck underneath the earlobe. The Diamond Care booklet, which was included with your Diamond system, lists all contraindications and precautionary measures in treatment protocol. Refer to this manual often to obtain precise technique procedures and skin analysis information to deliver optimum results to your client.